Hey guys, how's our mobility going? We're going to be focusing on a lumbar flexion base today. We're going to need a band, a yoga block, a yoga mat, and we're going to need a kitchen chair. So a sign of a healthy spine is individual control in flexion and extension of our spine. And when we're doing our segmentation work, our spinal segmentation work, we will see that sometimes we move as a block of vertebra rather than individual flexion and extension. And that's when we need to work on our mobility health. So this is focusing on lumbar flexion. Let's give it a go. Okay, thoracic cars. Stand with legs apart. We breathe in and irradiate. We're gonna squeeze our yoga block. Let's go to the right. We'll come down into flexion. And then we'll go to rotation, laterally bend, extending. Extending, laterally bend, and rotation. We're trying to find the biggest circle possible. Slow and controlled. Let's do 4 to the right and 4 to the left. Try not to move and compensate in other areas of our body and our hips. We only want this movement to come from the spine. Okay, last one. And then we're going to go to the right and down into flexion. Great. Breathing in and irradiate. Let's go to flexion. We're going to the left now. Laterally bend, rotate, extend. Laterally bend, rotate, and flex. And last one. Slow and controlled, really search for that best possible movement in our outer range. And great. Okay, Jefferson curls, what we're going to do is stand up straight. We can slightly bend our knees. Legs can be slightly apart. And what we're going to do is start in extension, and then we're going to slowly flex our neck forward. And one vertebra at a time, we're trying to flex and round our spine. So slow and controlled, focusing on one vertebra at a time as we come down into flexion. We want to round that thoracic spine, and we also want to round that lumbar spine as we go down. Slightly bend the knees. Once we come down to a really strong stretch in our hamstrings, we want to slowly come up, focusing on that lumbar spine, and slowly one vertebra at a time, uncurl our spine, but one vertebra at a time. Excellent. Extending back. And chest out. Let's do that another 5 times. Slow and controlled, focusing on one vertebra at a time. Let's round our spine into flexion. Okay, 2 more to go. It's okay to slightly bend the knees. And last rep, let's make this the best rep yet. Slow and controlled, searching for that outer range. One individual vertebra at a time, flexing and rounding. Okay, perfect. Okay, segmentation in the bridge position. Laying on our back, arms by our sides, we breathe in and irradiate. We go into posterior pelvic tilt, and then we're going to then move one segment at a time into the bridge position. One segment at a time, maintaining posterior pelvic tilt. And while maintaining that pelvic tilt, we want to go back down one segment at a time and maintaining posterior pelvic tilt, feeling one vertebra go down at a time, coming down and into anterior pelvic tilt, back into posterior pelvic tilt, and then one vertebra at a time, peeling off the ground into that bridge position. Good, maintaining posterior pelvic tilt. One segment at a time. Going down into anterior pelvic tilt. It's really important that you maintain posterior pelvic tilt while we're going down and letting one vertebra at a time segment down to our pelvis and then go into anterior pelvic tilt. This is all helping to retrain that flexion and extension for a healthy movement of the spine. Let's do one more. Let's let this be the best rep ever. Nice and slow and controlled. Coming down one segment at a time. Good, and into anterior pelvic tilt. Great, well done. Okay, important exercise here because we were doing anterior and posterior pelvic tilts. We're going to be focusing on only the lumbar spine, and we're going to use a band so we have a neural input into different segments of our spine so we can really focus on different areas in flexion and extension. So what we do, come on down on all fours, position the band. I've got mine around L5. And what we want to do is breathe in a radio, stay in flexion, and we're in anterior pelvic tilt. Now we're going to go into posterior pelvic tilt. We're going to just focus on our lumbar spine for this one. slow and controlled anterior and posterior pelvic tilt. This is going to be really important because in our PAILs and RAILs, we're going to be contracting our spine and we're going to be trying to isometric load and contracting our muscles in anterior and posterior pelvic tilt. And we're going to be doing that in our end range of flexion in our flexion base. So we want to get used to this contraction in anterior and posterior pelvic tilt. Try and do about 12 to 14 reps here. Last rep, slow and controlled, in flexion, and going back to extension. Well done. Okay, lumbar flexion base. What we want to do here is go into a gentle stretch. It is a sensitive area, so the first time doing this, I really want you to just go gently and then build up over time. We don't want any pinch points or sharpness, and the contraction, we want to be safe and best effort. So we come to the kitchen chair, we want to come forward, bring our legs apart so that we can come into lumbar flexion, and we're going to then find the line of tension. We can pull our arms down so we can pull our spine into flexion. Let's start our timer. Our functional range conditional principles are we do need to be in the stretch for at least 2 minutes so we can start getting re-education and adaptation of the tissues. Really flexing forward, flex your neck down, your thoracic spine, and just do your breathing and getting into the stretch. Now, this is a very hard base to get our PAILs and RAILs contractions right. It's a difficult area to coordinate, but our posterior and pelvic tilt, that's what you want to be thinking about in our PAILs and RAILs, and also going into extension and flexion of our spine. So let's go through our PAILs and RAILs cues. So our PAILs contraction is going to go into anterior pelvic tilt. We're not going to be moving our spine because it's an isometric contraction. We're going to use the chair as a resistance to prevent any movement. We're going to go into spinal extension, but focusing on the lumbar spine in that position. Our RAILs contraction is going to be going deeper into posterior pelvic tilt and lumbar flexion. We need to focus on the lumbar contraction and our lumbar spine with this movement. Remember, we're trying to get individual control in flexion and extension of our lumbar spine and our spine in general. Okay, I'm going to count you in 5 seconds. Remember, we want to go into anterior pelvic tilt. 3, 2, 1. Anterior pelvic tilt, bringing our spine into extension. We won't be moving our lumbar spine. Keep contracting, building up that intensity. Keep going, keep going. 3, 2, 1. Opposite contraction. Bringing our lumbar spine deeper into flexion. We're going into posterior pelvic tilt. We're contracting abdominal muscles and we're going into flexion. 3, 2, 1. And let's go into our stretch again. 45-second stretch. And we're going to do another PAILs and RAILs. If you want to go deeper, you can pull in deeper here. Just find your line of tension and the intensity of the stretch that you want to go into for this flexion base. Okay, I'm going to count you in soon. Remember, we're going into anterior pelvic tilt and extension of our lumbar spine for this one. 3, 2, 1, and contract. Anterior pelvic tilt. We're going into extension of our lumbar spine. Contract. Contract. 3, 2, 1. Opposite contraction. We're going into more flexion here. Posterior pelvic tilt. Contract your abdominals into that flexion of the lumbar spine. 3, 2, 1, and relax. Let's find our line of tension. So we change the intensity by the length and contraction and the depth and the intensity of the stretch. That needs to be changed over time. This area is sensitive, so let's start off nice and slow, but nice and relaxed into that stretch. Good, 5 seconds to go, and we'll slowly come out. And let's slowly just peel our way up. And recovery, stretch, well done. Okay, roll-ups, guys, arms down by our side. What we're gonna do is breathe in, irradiate, and we're gonna lift up one vertebra at a time, starting from our neck. So I come into neck flexion, I start to flex my thoracic spine, and then we go into our lumbar spine and up in rounding our spine. Now to change the position, we can lift our legs and bend our knees. We can also use a band tied to something so we can go up and down into flexion and extension a lot easier. We can also use our hands to kind of help us along the ground as well. So let's just see how we go. Let's breathe in and radiate. Start with our neck. We're going into flexion. We're flexing our thoracic spine. And then we're going to come up into rounding and flexing our whole spine. And then one vertebra at a time. Maintain that posterior pelvic tilt. Then come down one vertebra at a time. Fantastic. Flexing our spine, coming up one vertebra at a time. Slow and controlled. Last one, let's make this the best rep. Yet one vertebra at a time, really focusing on that. Maintaining our posterior pelvic tilt as we go back down and lay one vertebra at a time. Good, awesome. Okay, spinal segmentation on all fours, starting off in extension and then going into posterior pelvic tilt, really focusing on one segment at a time as you come up into that extension, squeezing down with your arms, looking towards your knees, initiating from the lower back into anterior pelvic tilt, flexion down through into our lumbar spine, up to our thoracic, to our neck, looking up towards the ceiling, squeezing down, and then we go into posterior pelvic tilt. Slow and controlled. This is a sign of spinal health when we can have individual control in flexion and extension. Initiate from the lower back, posterior pelvic tilt. Try and get that wave going into that thoracic spine. Good, 2 more. And last rep. Well done, guys, way to go.